Black Patent Shoes Dancing with Multiple Sclerosis by Eva Marsh. Foreword by Dr. Alan J. McComas, M.D., Professor Emeritus, Biomedicine at McMaster University, Department of Medicine, Neurology. As read by Mark Ironside. When Eva first appeared in my office, a few months after I had left the UK to take up a position at McMaster University, I was told by my secretary that there was a young woman who had some questions to ask concerning the nervous system. As Eva swept in and started asking her questions, I began a long and gradual process of getting to know her and of learning her remarkable story. And it is a remarkable one. As a young mother, to be struck down by paralysis and to be told that you have multiple sclerosis must surely be bad enough. To be deserted by your husband and left with 2 young children would be an impossible burden for most to bear. How Eva was able to rise above her adversity is the story of this book. There's much frankness in the book, and it would therefore be out of place if I did not admit that, as a practicing physician, I was initially disconcerted by Eva. We neurologists especially are dependent on the categorization of established knowledge. For example, we like to make a precise diagnosis in a new patient and then to give an accurate prognosis. Or if we rightly hesitate to convey bad news to our patient, we wish to have at least in our own minds a clear picture as to the likely outcome of an illness. Even in research, when our minds should be as free as possible, there is a curious reluctance to shed old knowledge and to embrace new discoveries and ways of thinking. If it is difficult to respond appropriately when another member of the medical profession provides the stimulus, the challenge is all the greater when it comes from a patient such as Eva. Reading her book, we should ask ourselves how Eva managed to recover so completely from each episode of paralysis. Many, I suppose, will consider that she was an unusually lucky patient. But as new information is gathered concerning the interactions between the mind and the endocrine and immune systems, may we not wonder if Eva's unquenchable spirit was a major factor in her remission. In recommending this book, I would like to join with Eva in singling out the late Dr. Daniel Levy for praise. As a neurologist serving the Hamilton region for many years, Dr. Levy's kindness, clinical skills, and enormous empathy helped thousands of patients and relatives through difficult times. Eva was one of those patients. To those joining McMaster University, such as myself, Dr. Levy paved the way for a successful, enjoyable, and enduring town-gown relationship. All this and much more is contained in Eva's story. I strongly recommend it for reading, not only by patients with multiple sclerosis, but all those with serious or long-standing illnesses. Her message is clear. Find out as much as you can about your illness. Listen to the doctor, but think the problem through for yourself. Form your own judgments and make your own decisions. Try to maintain your independence. Above all, no matter how bleak the future appears, keep on fighting. Doctors and other healthcare professionals will also benefit from reading Eva's story. Foolish indeed is the person who thinks he has nothing to learn.